Effects of erectile dysfunction on men's health. When a man's penis could not be hardened enough to penetrate a vagina, or maybe not enough blood or no blood is pumped into penis muscles to maintain an erection, he is said to have erectile dysfunction. In other words, it is called impotency because such men will lack the capacity to impregnate women. The number one problem of erectile dysfunction is unsatisfactory sex life. Others include low self-esteem, embarrassment from sex partners, depression, and anxiety. ED is caused by one or any combination of the following medical problems: smoking, alcoholism, abuse of drugs, neurological diseases, being obese, and cardiovascular diseases. In this presentation, more light will be beamed on the prevalence of ED, its symptoms, causes, risk factors, treatment, and natural remedies. Prevalence. The percentage of men affected by ED is increasing by the year. It was reported that 50% of older men will experience ED and 1 out of 10 men below 60 years will experience it. Symptoms: inability to have or maintain an erection is normal. It becomes a problem when it occurs frequently or when sexual desire is reduced over a long time. Causes: when men are affected by ED, the culprit could be any of the following: obesity, sleep disorder, smoking, diabetes, Parkinson's disease, high blood pressure, multiple sclerosis, MS, and high cholesterol. It may also be caused by spinal cord injury or the effect of surgery on the pelvic area. A side effect of prostate cancer treatment and metabolic syndrome can also cause ED. Furthermore, there are psychological factors that can result in ED. They are relationship problems, excessive stress, and persistent depression. Risk factors: diabetes, heart condition, tobacco addiction, and obesity constitute the highest risk factors for erectile dysfunction. Others are prostate surgery, radiotherapy, penis injury, drug abuse or alcoholism, depression, anxiety, and blood pressure medication. Additionally, bicyclists are exposed to ED because bicycle seats can cause injury to blood vessels and nerves that help erections. Treatments. This presentation is incomplete if the treatment of common men's health problem is not properly discussed. There are so many erection pills in the market, sometimes called oral medications. Many of them are effective for the treatment of ED, but proper care must be taken in the procurement of these pills. It is important that these medications are approved by the Food and Drug Administration of your country. Examples of these pills are Viagra, Cialis, Levitra, and Sendra. It is worthy to note that any of these pills must not be used if you are taking medications that contain nitrates. Reaction with nitrate can lead to an irreversible and dangerous decline in blood pressure. Other side effects of the above pills are back pain, stomach upset, headache, vision impairment, and flushing. Though these effects occur in rare conditions when they are abused. Another form of erectile dysfunction treatment is Cabreject Injection. The penis will be injected about 30 minutes before sex. Alternatively, suppositories of the drug can be placed directly in men's urethra instead of injections. In the case of extremely low testosterone levels, testosterone therapy may be necessary. In the manual treatment of ED, a vacuum pump, electric or hand-powered, can be employed to draw blood to the penis, then a ring is quickly placed around the base of the penis to maintain the erection. Surgery should be the last resort in the treatment of erectile dysfunction. It is done to repair blocked vessels that prevent the flow of blood to the penis. However, if the problem is psychological, a visit to a counselor or psychotherapist will be very helpful in this regard. Natural remedies: by changing your lifestyle, you can resolve ED or prevent it, thereby making your overall well-being to be improved. The following tips will be helpful: regular exercise, fitness, treatment of drug abuse and abstain from alcohol, quit smoking, lose weight, maintain a good relationship, proper stress and anxiety management.